Why your blocked nose won't clear. Have you ever noticed your nose gets more blocked the moment you lie down? There's a reason for that, and it may have to do less with airflow than you think. Many people assume that nasal blockage is purely structural, but inflammation plays a larger role than you think. When you lie down, mucus pools, post-nasal drip happens, which leads to the swelling of inflamed tissues. The result, your nasal passages are blocked, even when the airway itself may not be physically obstructed. Hi everyone, I'm Dr. Mark Chern, and at Chinese Doc Singapore, I work specifically with allergic conditions. Today I'm sharing about allergic rhinitis, but I also share about other conditions in my other videos. For example, here's one case about how I treat chronic eczema and TSW. Back to allergic rhinitis. Why do people still have blocked nose even after using antihistamines, nasal sprays, immunotherapy, and even surgery? One big reason is because they have allergic tendencies. And for these people with allergic tendencies, their body tends to generate a lot of these inflammatory cytokines. So these inflammatory cytokines contribute to swelling, mucus production, eosinophilic inflammation, and nasal hypersensitivity. The end result is a blocked nose. The nose is blocked because the tissues get inflamed and swell, and also the mucus starts to pool and accumulate. And this is where Chinese herbs may have a role. Emerging research suggests that certain Chinese herbs may influence inflammatory signaling pathways involved in allergic rhinitis. In clinical practice, we use pattern differentiation to determine which herbs are appropriate for which people. However, there are some herbs that always hit the target. And I'm going to share a little here. These three herbs, they are useful for morning sneezing, which I talk about in this video, but they're also useful for blocked nose. Why? Because at some level, it reduces the inflammatory tendencies, which then reduces the swelling in the nose and the pooling of mucus inside. So remember, the objective is to reduce the inflammation that keeps producing the congestion, swelling, and mucus. Some of you have already tried using antihistamines, and I talk about it also in this video about why Chinese herbs might work when antihistamines don't seem to help. If your nose blocks up for most of the day or at night when you lie down, ask yourself, is this something that's already managed with available tools like antihistamines and nasal sprays? Or is there something deeper that Chinese medicine can help with? For many allergic rhinitis sufferers, it makes a lot of sense to try Chinese medicine and add it to your stack if other things are not working so well. If you'd like to see how this played out in a real patient who had already undergone surgery but still suffered from allergic rhinitis, watch this full case study video next. Thank you.